Hi, this is Dr. Dan Bachman at Austin Spine and Sport, and today I'm going to talk to you about anti-inflammatories, and we're going to compare them to the donut that you have in your trunk, the small spare tire that you throw in your car if you have a flat tire along the road. The idea and the purpose for that donut is not that that becomes your new tire that you drive around town with for the rest of the life of your car. It's that that tire will bridge the gap between where you're broken down and stranded on the side of the road, get you to the tire store where you can then have your tire repaired or put a new tire on. In the same way, anti-inflammatories are designed not to get you through life and manage aches and pains on a daily basis, but they are very useful at helping get you through acute phases of an injury. So when you have enough pain, inflammation, swelling to cause limitation or functional problems, keep you from sleeping at night, for example, keep you from getting through your workday, or prevent you from going through a therapeutic rehab plan that can help you fix your problem, the problem that's underlying. That's the usefulness of an anti-inflammatory, not as a daily use management tool. It doesn't actually fix anything. It helps get you comfortable during the worst part of an injury, the acute phase. So if you find yourself relying on Advil, Aleve, Motrin, lidocaine patches, steroid injections, or even ice or heat in order to get you comfortable enough to get through your day, that's a good time to reconsider your treatment methods. Talk to somebody. Find out if there's a cure or a treatment or a way to resolve the underlying problem that's causing you these symptoms. Anti-inflammatories, painkillers, etc. These are tools for treating symptoms, not for treating underlying causes of those symptoms. So rather than trying to make do with pain that you have on a daily basis, talk to me or someone like me, and it's worth the investment to find out what the true cause is, and who knows, the fix may be a lot easier than you think. All right, great to talk to you guys. I'll see you soon. Bye.
Austin Health is sponsored by Austin Recovery.
Austin Recovery Detox is rather unique in the fact that we're not simply just a medical facility where the patients lie in the bed and we monitor them medically and intervene with medications as needed and deemed appropriate. Rather, our clients, we utilize very symptom-specific or targeted treatments to help them comfortably wean off of their drugs of abuse.
The first days of an addict's recovery are the most critical.
So let's see what kind of crisis she's in.
And can be fatal if not managed properly under medical supervision.
They can experience symptoms that are as benign as just simply being discomfort, such as nausea, vomiting, agitation, anxiety, difficulty with sleep. However, they can escalate to severe symptoms which can culminate in coma, delirium, hallucinations, and indeed they can even experience seizures and possibly even death.
Austin Recovery offers detox plus 30 and 90-day residential programs and outpatient.
I went from beer to alcohol. None of it seemed to work because these consequences keep popping up in my life.
Alan Jones is the team leader in the detox unit at Austin Recovery. He guides clients who are struggling with drug and alcohol addiction through their first steps of recovery.
It's very painful, the detox process. Not only are you coming off of the chemicals that you have put yourself through, you're also away from loved ones. You have no idea what's going on in the outside world, and that's a little scary.
Jones can relate. 6 years ago, he was a patient at Austin Recovery and has now turned his life around and is helping others do the same. Many of those who are battling both drug and alcohol addiction at the same time.
We do know the longer you're in treatment, the likelihood of success is increased.
Austin Recovery prides itself on providing a safe haven for those with nowhere else to turn.
We get to a point where we're starting to go to jail, where we're starting to lose family members, where we're losing a lot of money, and we're starting to lose friends, and we can't figure out why.
It's a chance for counselors like Jones to help them realize there is life after addiction.
My life today is if I could bottle it and give it to someone when they first get here, I wish I could, but I can't. The stages that we go through in recovery, the beginning is hard. There's a lot of work to be done. There's a lot of soul searching to do. But when you get past that, when you get into the recovered stage, and when you get to where the obsession to use and drink is lifted, life gets so much better.
For Austin Health, I'm Kathleen Jennings.
Austin Health is sponsored by Austin Recovery.
Clients come to us who are typically broken, lost, sad, scared. They come to us wanting help, wanting to get back to that happy, reliable, dependable person that they were before they were fully captured by addiction and alcoholism.
Austin Recovery is helping transform patients, helping them overcome their addictions.
Alcoholism and drug addiction is a disease. It's not a matter of willpower, it's not a matter of poor character, it's not a matter of always a conscious choice.
This is the largest nonprofit residential provider of substance abuse treatment in the state.
We have 9 distinct programs, from medically supervised detox to intensive outpatient, and a lot of levels in between.
It's a commitment that dates back to 1967. It was known back then as the Austin Rehabilitation Center, or ARC.
We actually started as kind of a halfway house. We worked with the Department of Vocational Rehabilitation to help people find jobs and establish themselves in recovery, and so it grew from there.
Today, Austin Recovery helps 2,500 clients per year. Half of those clients are part of the indigent population in Central Texas. It has always been its goal to help those in need who can't afford it and make it affordable for those who can.
For many people, treatment today for a typical 30-day stay is you're looking at $25,000 to $30,000, where we are like 75% under that or 80% under that.
When clients come in here, they often think that because they have problems, they have to use drugs and alcohol. And part of our job as clinicians is to change that.
The Austin Recovery Team is made up of nurses, direct care staff, master's level clinicians, and licensed addiction specialists who have the necessary tools to truly make a difference in a client's life.
One of the things that sets Austin Recovery apart is over 200 employees that are dedicated to our mission and dedicated to working in the nonprofit world. Many of our staff are in recovery. I myself am 26 years in recovery as a CEO. So we have a strong foundation here in working with our clients with a lot of people who have been through the experience themselves.
It is amazing as a clinician here at Austin Recovery to watch our clients break through the shells, the hardened shells that addiction and alcoholism have created, and become, once again, the beautiful people that they are inside.
Alcoholism and drug addiction can affect all races and all types of backgrounds. It knows no boundaries. It is the mission and hope of Austin Recovery to break that cycle.
We've been here since 1967. We will always be here. And it takes a special place to appreciate what this illness is about, and not to be treating it as just another psychiatric illness or another physical illness. Chemical dependency is a special illness, and it requires a dedicated group of people behind it who will make sure that a facility is here to provide the services that are really effective in helping people recover.
For Austin Health, I'm Kathleen Jennings.
Hi, my name is Sean Winters, and I'm an addict and an alcoholic. I came to Benchmark because I was hopeless. My life had become unmanageable. I didn't know where to turn, I didn't know what to do. This life I was living a path of destruction, and I needed help. Benchmark provided that for me. I came here scared, afraid of what was to come. I'd been living in fear, and I didn't necessarily want to change, but I knew I couldn't continue to live the way I had been living. Benchmark gave me a solution for that, a permanent solution. They showed me a new way to live, and this new way of life has been fantastic for me. I now live a life of integrity, a life of principles that they taught me here. Working this 12-step program and learning to live again through Benchmark, I'm so grateful for everything they've given me. This is a gift that I've been given, this gift of sobriety. And the things they've done for me, I haven't ever been able to experience anywhere else. I've been to treatment before and it didn't work. It was basically covering up the real problem, which was me. I was there to solve a drug problem, not a me problem. And I have a lifestyle problem, a life problem. And when I came here, they helped me see that, and then they helped me work through it. And today, I don't have to live that way anymore. My life is great today. I have so many opportunities available to me that were never available before.
am Noelle and I'm an addict and a Benchmark alumni. Before I came to Benchmark, my life was a mess. My life was consumed by my drug use, and I had lost so many things. You know, my family didn't know what to do anymore. Friends stopped answering my phone calls. I started planning everything that I did around my drug use. I wasn't living my life, you know, I was just existing. I didn't think that there was any other way of life, and I thought that if being sober would be boring, but it's not like that today. You know, I've never been happier. I've never felt so whole. I haven't felt the desire to use drugs anymore, and that is not normal for me. And it's something changed here by coming to Benchmark. I learned something and was given a different solution other than drugs that can work for the rest of my life.
I never thought that my actions would ever find their way to hurting my family or the people that I loved. And now I was faced with a very real prospect of that and more. I at the time was robbing drug dealers because I thought they're never going to call the cops. We started getting phone calls from everybody that knew us with a lot of fear in their voice, and we didn't know why. There were people with machine guns and Uzis and shotguns breaking into everybody that we knew's house and waking them up in bed demanding to know where we were. These people were armed, they were very dangerous, and they had a lot of money to throw around and offered it for any information as to where I was headed and where my family was located. And I was running. The man who had put the hit out on our heads, he had been in a car accident and died himself, and we were informed that we were safe to come home. I started drinking real heavily. I was ashamed of who I was ashamed of what I knew I was capable of and what I had done all my life. I thought an addict was someone with no willpower, that needed something, that needed to depend on somebody or something in order to be okay. And that wasn't me. I was the one-man army. I started trying on my own, very hard to quit. And after months of that, I almost completely gave up because I couldn't do it. So I went to the bishop, and he gave me the ARP, the Addiction Recovery Program manual. I learned a great deal, but again, I thought I could do it on my own. Then he mentioned that there were group meetings where people like me met together and shared each other's struggles. It's very hard to describe the empathy, the love, the honesty, the humility that you feel when you walk into that group. They've all been there to one degree or another.